This is a blueprint to unlocking your back pain. I literally started this course because I just got so frustrated with the medical system and how many clients were pushed off to having to get injections, being on medications, doing surgery, after surgery, and just really feeling like they just have to live with their back pain. So, this is the first course of some other courses that I'll be doing, but we have to get to where the source of the problem is coming from. And that's what this course is all about. We are going to help navigate your pain and figuring out where the source is coming from. Because if you don't figure that piece out, you are just treating a symptom. So, before you get started, I want to make sure that you have filled out the preset of questions because this is going to help guide you in the process, pulling things out of your brain and not making you think that, oh, that sounds like me. No, let me go to my sheet of questions. Let me go look through this so that as we're going through this course, you're going through your sheet of questions as well to help you navigate and figure out where the source of your problem is coming from. So let's get started. This is module 1. And we're going to go over and do kind of an overview of the spine because I want to help you understand how everything is connected. I often say where the side of the pain is often not where the source of the problem is coming from. And that's what we're going to really talk about and kind of show you how everything is connected. So, basic anatomy of the ribs, the back, and the hip. There are three main sources that can create back pain. Your ribs can create back pain, your back can create back pain, and your hips can create some back pain. So, let's see how all of this is connected. If we look at this video and we watch, you can kind of start seeing that you can see where the ribs are up and through here. Here's the back part of the spine, and here are our hips. But as we're watching this, you're going to start seeing how different muscles are connected. So you can see how some of these muscles get connected into the spine. But as we keep on looking, you're going to see the layers of the muscles. So you can see how these muscles connect to the pelvis and where we can get some back pain through here because of ribs being tied up here. We can have tightness through here because something is going on with our spine. You can also see how everything up through here is connected down and through here. You can also get tightness that happens in the hip as we're watching this, that can create pain in through here. So if parts of the hip aren't moving, then what happens is our back is having to take over. So that's where it's really, really important for us to kind of see how everything is connected. Now, our first phase of treatment, when we look at everything, is we've got to look at the mobility, because what happens is if the ribs aren't moving, then you'll get protection from these muscles. So muscles often are protecting something, which is why if you just go to the muscle tightness, you're not necessarily going to solve your problem. You have got to get to the mobility and how things are moving. So if your ribs aren't moving up here, what happens is the muscles through here are going to protect. And then these muscles come all the way down through here. So a lot of times you can feel pain in through here when you have issues in the ribs. Now, you can have, if we go back and you look at the very beginning, as we look at the spine, in between the spine through here, you have discs. You also can have issues within those discs. We're going to talk about that here in a second. And that can create back pain, and that can create muscle tightness that will protect and tighten up, where you've got to get to the source of why the muscles are tightening up. And so then you can also have it where, again, like your hip mobility doesn't move. So you'll notice that like one side's tighter, like you can't do a figure 4. It doesn't move as well in that rotation type position. You're stretching it, or maybe you're having a lot of hamstring tightness. But the hamstring tightness is because the hip is not actually moving. And so when you look at all these things, that can create protection. Hip doesn't move very well, the back takes over, and that can create some back pain. So you've got to look at everything as a whole, but that's what we're going to kind of talk about and dive a little bit deeper in. So you could be stretching the wrong way. And, a lot of times, like I said, the muscle tightness is just a symptom. We have got to look at how everything is moving, because more than likely, if something's not moving, then the muscles are going to protect. But what we often do is we stretch those tight muscles. So we bring our knees into our chest. We'll do a figure four stretch. We'll stretch our back muscles by doing some sort of rotation. We'll roll our tightness muscles out in the hip. But you have to get to why. Why is that tightening up? And that's what we have to get into. And we're going to be talking about that as we go into different modules as to what each section looks like and presents like. But I want you to get out of this is the fact that a lot of times the tightness and the symptoms are just a symptom. And often we tend to stretch something that's tight when in reality, we need to be moving in the opposite direction because maybe the tightness is happening because the joint's not moving very well. I'm going to give you a perfect example. We had a client that came in and she was a dancer and she's like, my hamstring flexibility is not the same on my right side compared to my left side. And I've been stretching it. I've been doing dry needling to it. And it's just not improving. And I'm like, interesting. Okay. So we know the hip is not moving. It's creating some back pain. And creating some hamstring tightness. And so I went, we checked out her back. Her back was moving really well. No problems there, but her hip wasn't moving. So it couldn't move into, even when we took slack on the hamstring and we brought her knee into her chest, it didn't move the same way as the other side. When we took her hip into the opposite direction, into more extension, she didn't have the same mobility as she did on the other side. Her rotation was also limited. So we stretched her in the opposite direction. We stretched her into hip extension. Most people would be doing the figure four stretch and stretching the hamstrings because that's what's so tight. It was the joint that wasn't moving. So we moved her hip into more hip extension. And what that created was the joint started moving. And guess what? The tightness went away, completely went away. Her hamstring flexibility went back to 100%. She could kick again without having any problems whatsoever. Again, everyone focused on the tightness in the hip, the tightness in the hamstring, which was limiting her, but it was really her joint was not moving that was creating some of the tightness, that was creating some of the back pain that she was having, but it was actually coming from her hip and her hip mobility, which is why we have to look at mobility first. This is also why massage to your muscles do not work because your pain will come back in return. So it's always great to try. Go and get a massage. But if you notice within an hour, it comes back, within a day, it comes back, then the massage isn't going to work. You're just treating a symptom. And whatever's creating that muscle to tighten up is what is causing some of that pain and the problems that are happening. And that's what we have to get to doing. And that's what we're going to talk about more. So I always say again, where the site of the pain is often not where the source of the problem is coming from. And that's what I'm here to help you and navigate that piece of it. So how does the lumbar disc create pain? This is a common thing that we see in the back, very common, less common in the thoracic spine. The ribs are super stable, so they won't allow things to kind of move. But in the back, this is really common. So we have these discs that are in between our spine. And what happens is these discs are kind of filled like are gel filled. As we get older, they become more like particle filled. But movement, we can move them and we can create basically moving the gel to one direction and moving the gel in the other direction based on positioning. So what happens is if I go and pull and, I'm bent forward, I'm going to use my finger as an example. I pull my finger back, it puts a lot of pressure on the back side of this. Or if I pull my finger forward, if I bend forward, I'm putting pressure on the front part of that disc and it moves the gel to the back. Makes sense. Just kind of like a jelly donut. You push on one end, the gel will go that way. You push on the other end, the gel will go the other direction. Well, oftentimes what we do throughout the day is we are sitting and we're bending and we're cleaning. We're always in that bent position, which moves the gel to the back of the spine. Which guess what? That's where our nerves are. That's where our spinal cord is. And honestly, if you look at like just the disc structure, that's the weakest part of the disc is that back lateral part of the disc, which is usually where you'll get that herniation. That's kind of what this is a herniation. Everything's intact, but the disc is herniating, creating some issues down into it could be giving you some compression in your spine or in your nerves that can create pain down in your leg, but it doesn't have to. You can still have a herniated disc and it not hit your nerves, creating issues. So what it can do is it can refer pain. And this is often where you have a back issue that can create some hip pain because the referred pain goes down into our hip. When the pain goes down to the hip, the muscles tighten up, creating that pain. If you don't get to the source of where the pain's coming from, even if you release that tightness or stretch that tightness, your pain will come right back again. You've got to figure out where that is. So getting back to the disc, there's rings that go around the disc that keep everything intact. The majority of the time, everything is intact, and you can use motion to kind of move things away from the areas that are damaged. Much like if we have a scratch on our arm, and if we keep on stabbing that scratch, we continually have problems and it never goes away because we're constantly stabbing the scratch on our arm. Well, the same thing happens is with the back, is that we're doing things, repeated things, over and over again throughout the day that we don't even realize that we're doing. And that's like us stabbing the wound. And so if we're constantly doing things that are bent forward and our problem is in the back, what happens is you're stabbing the wound in the back and it never allows for that back to heal, which is why you constantly have reoccurring pain. It's also why when you have surgery, and no one ever gets into why the surgery happened in the first place, what did you do that created this? It wasn't from a fall. You're not really sure what you did, which is the majority of what happens with people that have um, back pain. They're not sure what they did. And so they go back, they have the surgery, they take the pieces out that are super irritated, whether it's a laminectomy or discectomy. Laminectomy, they're just opening up the space, essentially. Discectomy, they're taking the piece out of the disc that is irritated. And so what happens is you feel great. The irritated piece is gone, but you go back to the daily things that you were doing that created the problem in the begin with. And then all of a sudden, 6 months, a year later, you're like, I have the exact same pain that's returned. And that's what happens, which leads into another surgery because no one's ever getting into what you're doing throughout the day that's creating some of your problems. So if you're constantly stabbing this wound, then you're never going to get better. We've got to stop stabbing the wound. We've got to figure out what you're doing throughout the day that might be creating some of your problems, but as well as doing motions to move the disc material away from the area that is damaged. And we're going to talk a little bit more about this in another module as to what that looks like, and give you a better understanding of what that is. But this is how that lumbar disc can create some of that pain. You don't have to have a herniation. It doesn't have to be where it's bulging out to create pain. You can have material that's just displaced inside the disc that's not bulging that can still create pain, because around that disc are layers of rings. I kind of call them, they're called the annulus, but I kind of call them like ligaments. So think of like an ankle sprain. If you have an ankle sprain and you twist your ankle and you put pressure on those ligaments, it's going to hurt because it's damaged. Same kind of things. The rings around the disc are damaged because of things that you've been doing repeatedly. And so as you put pressure into that one area, you're going to hurt. And then your muscles around that area are going to protect. So again, it's figuring out if the pain is coming from the disc, the back, or is it coming from somewhere else. But this gives you a big understanding of the majority of what happens in our back that can create some pain. So what happens to the disc and the nerves when you bend forward? So this is something that is really common, so you can get a good understanding of what you're doing throughout the day that may be creating some of your problems. So if you bend to stretch your back or touch your toes, and you have a disc problem, this is what happens. So most of the time you get tightness in your back, and all you want to do is continue to bend forward, bringing your knees into your chest. Guess what? You're bending forward. It's pushing everything to the back. It may feel better because it's opening up that space, but essentially you're still pushing all that material into the back. So what happens when you bend forward is most of the pressure to your spine happens when we're bent forward. It increases the pressure in our spine. The least pressure in your spine happens when we extend backwards. When we're going backwards, it actually takes pressure off the spine. But throughout the day, what are we doing? We're always bending, we're sitting, we're always doing things that we're in that forward bent position. And when we do it for long periods of time, it will give us problems, especially as we get older, because in order for us to recover from that position, you have to be out of that position for a while. As we get older, it takes us longer to recover. So when that happens, then, and we go right back into those positions, we never fully recover. And then we start having problems, especially as we get older, because we don't recover as fast. We also are in the same positions day in and day out throughout our day. We're always sitting, we're standing, we're walking, we're biking, we're sitting, we're bending. Like we're always in that one same plane. When you're a kid, you're moving all over the place. I mean, we're throwing ourselves sideways and moving in so many different positions, and we're never in one position for very long as a kid, except now when kids are playing video games, they're starting to have the same issues that adults are having because we're seeing it in our office. But overall, when they're out there playing and moving, they're not sitting still for very long, which means that they don't really are, they're not in these positions for long periods of time like we are as we get older, because we tend to have sitting jobs. So the weakest part of the disc is when you flex, bend forward, and rotate. And what that does is it moves the material to that back part. Remember, I said that back lateral part, that outside part of the disc is the weakest part of the disc. And when we bend to flex and we rotate, because we're bending down to pick up something along the side, or we're bending to pick something up and pulling it onto our shoulder, whatever the case may be, that's going to put that disc into that weakest part. And if we do it long enough, or we've been in a bent position for a while and we never fully recover, and all of a sudden you went to go down to pick something up, you didn't even pick anything up very heavy, your back goes out. It's the accumulation of what you've done throughout the day after day after day after week after month after year. It's the accumulation of everything that you do that will all of a sudden, you'll be one motion and your back locks up. And that's why. It's because of the accumulation of the things that you've done throughout the years that is creating issues in our back at that particular moment. So more nerve compression happens when we bend forward. Because remember, if you look at that picture, if we're bent forward, here's the nerves are all the way to the back. The disc is right here, and we're bent in this front part of the position that can move the material to the back. So it's the likelihood of you hitting a nerve by bending forward is much higher. When you bend backwards, you're putting slack on everything. You're putting slack on the spinal cord, on the nerves. There's no nerve compression when you bend backwards. And so I just want you to kind of understand this piece of it, because it will make sense when we get into some of the other areas.